Good afternoon, everybody. Welcome to the APAPP podcast. We're live from Nashville, Tennessee this year. It's our second annual conference. Super excited to be here today. I'm Tyler Kuhk. I'm a pulmonary nurse practitioner based out of Bellevue, Washington. I'm also an APAPP board member and the honored chair of the COPD committee. And in this episode, we're diving into one of the fantastic presentations that we had this morning with our very own COPD committee member, Justine Sicari. She presented about COPD updates, integrating emerging therapies into patient care. And so we're going to have a conversation today about Justine's talk. Justine talked about a lot of really great things. She delved into a good review of COPD pathophysiology. She talked about novel and emerging therapies, and then more importantly, how to kind of interpret the safety and efficacy data so that we can use these therapies effectively in our patients. So we're going to talk a little bit about that. I did want to say I really did appreciate the recap that Justine did on the pathophysiology. I think something that stood out to me in the talk was that it's not just a smoking-related lung disease, which I think historically a lot of COPD gets that attention. And so factoring in, the diversity and the different reasons why people get COPD, I thought was a really good start to the talk. But it was a great talk, and I'm just curious, when you were making this talk, what stood out to you when you were making the talk, when reviewing all the new latest data?
Yeah, thank you so much. So I was so excited to give this talk today because we now have all these new and emerging therapies. What really stood out to me the most is how these different therapies can really improve quality of life. I mean, they are decreasing exacerbation rates, which in return helps kind of save our lung function. It's the less exacerbations patients are having, the better overall they're doing and the better our healthcare systems are doing as well. So I think, quality of life overall and decrease in exacerbations is what is driving these new and emerging therapies.
Yeah, I agree. I think exacerbations have got a ton of attention lately, obviously for valid reasons. And I think the quality of life factor is the important thing because, on paper, it sounds like, well, we're reducing an exacerbation, but really how does that translate to what our patients are feeling? And yeah, they feel better, reduced healthcare costs and things like that. And I think that we're at a very exciting time in COPD care where we actually have new options to do this tangibly that we didn't have before. And so while we're on that topic, when we're talking about the novel therapies, how do you see them kind of fitting into the algorithms that you're using? And how are they shifting your approach to patient care?
Yeah, I mean, I think each patient is unique and different. I think it all depends on what their risk profiles look like. Part of my talk this morning talked about, different stages doesn't necessarily mean that they may not be a certain group. What I mean by that is you can have a stage 1 patient who is a mild COPD patient, but still be exacerbating. Everybody is different. They have different comorbidities. There are different triggers. And, all of these approaches really can determine what kind of algorithm you go down as far as treatment. So, I try to listen to my patients, really review their charts, see, what the triggers are, what's causing them to exacerbate, what comorbidities they have, and just trying to address it as a whole.
And I think that that's actually a perfect thing. It's very holistic care. I think, as a nurse practitioner and also as physician assistants as well, I think we want to do a good holistic job when we're looking at patients. And I think the key thing is everybody's different, right? No, and not every one patient is the same. And I think we really need to listen to patients. I always tell, when I'm even precepting a student, listen to that history, right? You're really getting the patient's lived experience. And that really helps you kind of fine tune maybe what is next for what you're going to do and really kind of tailor that to the patient rather than, we have guidelines, they're great, but we can move within those guidelines to be more specific to the people that we're seeing, right?
Absolutely.
So when you are evaluating a new therapy for COPD, which we know there's a lot of new options now, what specifically in terms of like safety and efficacy are you prioritizing when you're making that decision?
Yeah, so I think it depends on the patient as well. As far as safety concerns, I had a conversation recently about the use of biologic therapy and just different dynamics in that patient population. You have to really be looking at, is this really going to benefit them, or, is injecting themselves, a risk for them or a trigger for them. So I think it all depends, and I think overall we just need to be mindful that we have these new emerging therapies that, we have to offer. And it kind of gives the patients hope. So I just, I think we all need to be mindful about them. But as far as patient selection and criteria, that's going to vary.
For sure. So you've had experience, obviously, we talked earlier, specifically with things like ensifentrine and obviously, dupilumab. Any specific cases you could maybe walk us through on how you, maybe brought this up and, implemented one of these new therapies on one of your patients with COPD?
Yeah, I was really happy to talk about some of my patient profiles that I've used these medications with. I mean, I have a patient who, no matter what I've given him, he's chronically dyspneic. He, thinks that he needs oxygen therapy because he's so short of breath, which is really a misconception of a lot of patients. They think, oh, I'm short of breath. That means I'm hypoxic. Fortunately and unfortunately for him, that's not a quick fix, because he's not. But I initiated ensifentrine and he has showed improvement in his overall symptoms. And that is, a value of that medication. Not only does it improve FEV1, but it can also help with dyspnea. And at the end of the day, sure, patients want their FEV1 boosted, but they will feel better. But at the end of the day, they want to feel better on a day-to-day, and they want a better quality of life. They want to be able to play in the park and run after their grandchildren and do all of those things. So I think these therapies allow them to do that.
I think that's the satisfaction we get from working in pulmonary medicine. People, you fix hypertension, you fix cholesterol. They don't feel it as much, but us in pulmonary, we get rid of coughs. We help people's congestion. We make people breathe better. And I always say it's like my selfish reason, because I like the satisfaction of having such a profound impact on patients. And I think it's even more empowering now to us as APPs to have all these different options. And I think the quality of life thing, again, it's always going back to quality of life. Yeah, it improves lung function. Yeah, it does all these different things. But at the end of the day, the patients feel better. They remember us for that.
Sure.
And we know our patients so well that we, over time, when we develop relationships with our patients, we know what the disease is doing to them day to day. And it makes us better assessors, right, when we're assessing their response to the therapies.
Yeah. And I think that, what that looks like for each patient is different. Mm-hmm. And that's the value of being, a nurse practitioner, a physician assistant. We have the time, we have the experience to create that bond and really, get to the nitty gritty of what is affecting the patient's day to day. And I think overall that's very impactful.
For sure. And I guess while we're on that topic, when we're bringing this up, how do you approach education and shared decision making? Because these are new therapies and, there might be some reluctance or some misunderstanding. So we do need to spend more time with them to educate them and include them in the process. So what kind of strategies are you doing in your practice to implement that?
Yeah, that's a great question. So I do have a special population that may have lower IQs and just overall socioeconomic status. So I like to do a lot of visual education. I really take the approach of you need to take the different time with different patients. Like some patients don't need a lot of time. Some patients need a lot of time and explanation, but like really demonstration and showing them like, this is what's going on with your lungs, like showing them this is your CT scan. This is the effect that your disease has on your lungs. I think that's very impactful, especially when trying to introduce new therapies. Definitely laying out like, this is what is not working for you. And, this is what we have now. And we need to try it because, we need to try to salvage your lung function. And we definitely want to try to keep you out of the hospital as much as we can.
Yeah, I think you touched on the health literacy component here, and that's a challenge, I think, throughout the entire country.
Yeah.
And I think APPs specifically we play a role in really helping improve that, right?
Mm-hmm.
And it takes time and it takes education. And I think that an empowered patient is a patient that's going to be more willing to be, to partake in their disease. They understand what we're treating.
Sure.
And I think a lot of patients, and you probably would agree with me, they come in with very poor disease insight. Nobody's ever sat down with them and explained these things to them. And in some cases haven't even really included them in terms of a decision. And so I think that, we have all these great things, but while recognizing the health literacy challenges and then, knowing that what we can do to improve that. So that's great.
Yeah. And I think the feedback from patients too that I see a lot is like, oh, thank you so much for explaining that. I didn't understand, or I didn't realize, or, when patients are acutely ill in the hospital and we have these people coming in to talk to them, it's so overwhelming. Not only are they ill at that time, there's multiple disciplinary people coming in, talking about different things. It's very confusing. So I think that's the importance of follow-up from discharge and, just definitely having APPs involved in the care of patients.
Yeah, I call it my debrief visit, right? There's a lot going on in the hospital. And in fact, we've done kind of work on this in my organization. And I think you have to be careful not to overwhelm them because there are a lot of things going on. But I think having that hospital follow-up is so important. But if you can connect with them before discharging too, is just to develop that rapport and some kind of, some basic understanding. But that's our time to shine, that debrief visit. I think that we have a lot of opportunity there to really develop rapport with our patients and really kind of gauge what kind of person they are, what their challenges are, and then how we can kind of work together to, to come to the best outcome for them.
Absolutely.
So it all sounds great on paper, right? We have these great studies, we have these great medications, we have awesome guidelines. But looking ahead, I mean, it's an exciting time, of course. What do you think are our biggest challenges and also maybe some opportunities in kind of adopting these emerging therapies?
Challenge-wise, I just think that it's not black and white. We're treating a disease that is progressive. And every patient is so different, and there's so many different pieces to the patient as far as demographics, comorbidities that look different. So, the use of these emerging therapies, sure, they're all promising. Will they work for everybody? Probably not. But I think the more that we are, trialing them and creating education in our own space, like at this conference, and bringing things back to our team and talking about, just keeping the conversation going. What can we do to help patients? I think that is what's going to get us, further along.
Yeah. And any thoughts on this? Like, we've had a paradigm shift, I think, in COPD. And I think in probably a lot of actually respiratory diseases. But I said yesterday, when I joined the Palm world like 9 years ago, I didn't expect to get into immunology like we're getting into immunology now. And I think that especially with a disease like COPD, we've seen strides in cardiovascular diseases and things like that. And we're seeing the real repercussions of COPD now. But really, I think a challenge too is us, right? Is us really understanding this, incorporating different, biomarkers now into workup. And a lot of people might not be doing that. And that's why I think it's important for us to have an avenue through an organization like APAPP, and our COPD committee to really network and get the word out for these new types of therapies and ways to work it up.
Yeah, absolutely. When I started about 6 years ago, taking care of pulmonary patients, little did I know that there'd be such overlap with rheumatological disease, gastroenterology disease, ENT and allergy. COPD really affects everything. So, the better that we continue to stay on top of these things and keep talking about these things, I think the better overall we are going to be at caring for these patients and really taking a holistic approach.
Yeah, it's definitely an exciting time to be in pulmonary medicine. I will say, to the newer APPs in pulmonary that are out there, we've been there, and it takes a while, but it's amazing to look back at 9 years of practice, 6 years for you, and all that's changed, and how our understanding has evolved.
Yes,
and our confidence, and that does take time, but I think it's a really good time to be in pulmonary medicine. There's a lot of great resources. We've had a great discussion today. I think that's going to wrap it up for today's episode of the APAPP podcast. Yeah. We're definitely going to have Justine back again. A huge thank you to Justine. She whipped up this talk that went off with a bang this morning. I think it was more attended than we anticipated. That to get extra chairs in the room. Yeah. But just a fantastic way to start off the conference, I think, especially with the exciting new realm of what's going on in COPD.
Absolutely.
So I want to really, first of all, thank you for your work on the committee and for doing that talk.
Thank you.
For anybody listening, if you found this discussion valuable, we want you to come to the conference. If you're not here this year, come next year. Yes. We plan to do this annually. There's going to be some regional meetings too. So please get, network with an APAPP member, reach out to us, social media, our website. We want to connect with you. We all started wanting the same things. We wanted pulmonary friends, especially APP friends. Yes. We're out here. Find us. We will take you under our wing. And we'd like to also extend, a sincere thanks to Beatrice and Verona for their generous support at making Justine's talk happen this morning. They have a huge commitment to empowering and educating APPs, and we really value that relationship. So thank you again, and thank you everybody for listening.
Thank you.
Until next time.